So we want to look at the prevalence of lower genital tract infection. Looking at the prevalence of this disease is more of like you're looking at the epidemiology of the disease. Okay, looking at the disease condition and looking at how it has actually affected the human population at large. So for lower genital tract infections, we said that the prevalence actually varies widely. Okay, this is depending on where the people are staying, depending on the socio-economic status. Okay, also depending on the sexual behavior and how these people have access to healthcare or not. Okay, so global and regional prevalence, we said that they're actually most common in they're actually the most common reproductive issues in women. Okay, especially women that have hit the reproductive age. Then in Africa, studies shows there's high levels of lower genital tract infections among both infertile and pregnant women. Okay, so Neisseria gonorrhea was isolated in about 17.4% of infertile women and 10.5% of pregnant issues. Okay, so there's high prevalence of Candida albicans causing Candidiasis, Trichomoniasis vaginalis causing Trichomoniasis, which is a sexually transmitted infection. Then also what? High prevalence of Staphylococcus aureus. So in developing countries, the Candida and the Gonorrhea vaginalis are frequently isolated. Okay, so you see most women having it without even showing any issues, any symptoms. Okay, no signs. They're just having it quietly like that. So common pathogens that we study are related to lower genital tract infections and the type of disease conditions they cause. Candida albicans, Candidiasis, Gonorrhea vaginalis, BV, that's bacterial vaginosis, Trichomoniasis vaginalis, Trichomoniasis, Neisseria gonorrhea, Chlamydia trachomatis causes Chlamydia. Staphylococcus aureus will basically strike when your immune system is no longer competent. Okay, so they cause a lot of issues leading to infertility, pelvic inflammatory disease, complications when someone is pregnant. There's even a risk of the person now contacting HIV and AIDS. Okay, so that's what we have here for the prevalence of this disease.